So for those of you who are just joining me, my name is Pamela. I'm 26 years old, and this is the third video in a series of videos that I'm doing about my cancer journey. Currently, I am in remission, which I announced in my last video. In this video, I'll go more into that at the end because I am still doing chemo, and I'll explain myself on that later. But this video is about my fertility in relation to having to have chemotherapy for treatment for my cancer. So I'll just get started. I met with my hematologist after I got out of the hospital to go over what cancer I have, specifics on it, my PET scan, what I need to expect. And going into that meeting, I had obviously plenty of questions, but one of the main ones that were really important to me was, how is this going to affect my ability to have kids later? I have a history of infertility, and I've taken just the pills. I've never done the shots because I never got that far. So I knew that I already had that going on, and I'm not currently doing any kind of fertility treatments, or I wasn't at that time either. So I didn't know exactly what was wrong, but I know it was on my end. So going into it, I asked him, so how's this going to affect my chance to have kids later, my fertility? And he said, well, chemotherapy, it's usually harsher on men as far as their fertility, and kind of sterilizes them. Not kind of sterilizes them. And in women, it does affect your eggs. It alters your eggs. I mean, chemotherapy is basically somewhat like a poison going into your body. It does all kinds of damage. Some of it short term, some of it long term. And I am on 3 different chemos. 2 of them are very strong. One of them is one of the strongest ones that's out there currently. So I told him it's very important to me that I do whatever I need to do to make sure that later on in life, when I'm ready, that I can have kids, because more than anything, I know that I want to be a mom. That's definitely my biggest want, I would say. So he stepped out to the hall and called his colleague that's part of the hospital network, and they immediately were able to squeeze me into that following week, which, if you've ever tried to see a fertility specialist, that's unheard of. You usually have it to wait at least a month before they could see you. They stay pretty booked up. So I was really grateful for that. I went in, I met with the fertility specialist, and he kind of went over what they would need to do, which would be the egg retrieval surgery. That they retrieve eggs, they freeze them in a storage unit, and when you're ready later on to start a family, you get those eggs a certain amount, and they do IVF, in vitro fertilization, where they take fertilized egg and put it in. So I was like, yes, I want to have my eggs frozen. If there's any chance for me to have my own kids later, I want that chance. After he went over that, he went over costs. And if you don't know, most insurances, I don't know that any fully cover fertility costs. They don't cover medications, they don't cover the tests that they do, most are like surgeries or anything like that. They may cover some things, but for the most part they don't, and for any kind of fertility treatment is very expensive. So I was given a certain number, and I said, okay, I'll figure this out. If there's a will, there's a way. So that's just something to really think about if you are thinking about seeing a fertility specialist, is really consider cost, or maybe putting some money aside to help you in that process. And then he went on to kind of draw out how the egg retrieval surgery goes. So on like a little piece of paper, just grabbed a pen and drew. Basically what they do, you're under anesthesia, and they go in with an ultrasound guided needle, in your vaginal wall, and they go to whichever ovaries have the eggs that they need. Either sometimes you might have both ovaries, sometimes it might just be one ovary. Doesn't take very long to do. They take those eggs and then they look at them under a microscope and see if they're mature enough to be frozen, because they may get some that aren't quite mature enough. They may get like 20 eggs, but only 15 of them are mature enough to freeze. So for me, they were able to get 12 eggs, and all 12 of those were mature. So I was fortunate enough to have at least 12 chances if I need to, because IVF doesn't always take the first time to have kids. So after I had that meeting with him, he set me up with his nurse. The nurse goes over kind of what you need to expect. She tells you we're going to do labs, you're going to get medications. There's a certain phone number for a pharmacy that you can call and talk to them and see if you could get a reduction on some of the costs of the medications, or some of them for free, because mine is related to cancer. So it's Oncofertility is what they call it. And I was able to get a few of my meds discounted and some of them for free, but they were still on the expensive side. Regular, if you just were going into this without a certain case, special case, those medications are thousands of dollars. So I was really fortunate for that. They also do labs. They did labs on me right after my consultation, because I told them I wanted to get started. So they do labs, and then they'll continue to do labs over the next, I want to say it was 2 or 3 weeks, to monitor how you're progressing, because you'll be giving yourself shots every morning and every night, and they give you the supplies. So once the medicines come in, you go back up to the clinic, and the nurse that I had, she was really phenomenal. She gave me her personal phone number if I had any questions 24/7 that I could call her and ask her about. So they give you these alcohol pads to clean before you give your shot. Then they had like insulin needles, a 22 gauge needle, and a syringe, and then some of these little 27 gauge needles with some syringes that I got with my first medication shipment. All of those are pretty small needles, with the insulin one being the smallest because it was the 28. She also gives you this little pouch which you keep in the refrigerator, because the medication that's in here needs to be refrigerated. This is the Follistim pen, which if you've ever seen an insulin pen, looks like this. You put the vial, this is my old vial, still have it in here. You put the vial in there, this unscrews, and there's this little vial that has the medication in there, the Follistim. And they give you a paper telling you how much to dial, your little dial over here, for the amount that they need you to take. So mine was lower in the morning than it was at night. I don't remember exactly what it was. I want to say it's like 75 and 150. But you do this shot, and here's a little needle. There's a little needle that you just, I'll pull it off. I'll just throw it away. Then you just take it on the end right here, and you screw it on, and there's the needle. And then you throw it away when you're done with it. So they also give you these biohazard containers so that you can throw your sharps away. I have 2 of them because I got 2 different medication shipments. So that's one shot. Another shot that I had to do was, I don't remember the name of it, because like I said, this was a few months ago. This was back in November, right around Thanksgiving. So I was very fortunate they would take me around that busy holiday. It is currently April. It was almost 6 months ago. The other medication came in a vial, and it was a powder, and then you had a vial of normal saline. So you had to draw up the normal saline, which is the liquid part, and then put it in the powder, and then kind of roll it around. You weren't supposed to shake it. Roll it around, and then you could draw that up, and that would be the medication that you needed for your injection. So that one I did at night. Yeah, at night. And that one burned. The one in the little pen didn't burn. But the one, yeah, that one burned a pretty good bit. It only burns for like 5 or 10 minutes, and it's not a severe, like just unbearable pain. The needles are so little that you really don't feel the prick. But I'm a nurse, and I've given hundreds of shots in my day, so you would think that this would be, oh, this is a piece of cake, but this is on myself, so I had to really, I'd sit here in this chair and coach myself into giving myself these shots. And anytime Tyler was here, I had to ask him, please give me these shots, because it's easier for me to get a shot from somebody than to give myself one, apparently. So kudos to those who are diabetic, because I don't know if I could do that every day. So there's that. They also give you some little booklets in here. I didn't read any of them, honestly. There's so much paperwork that goes with cancer to begin with. I just kept it in this little bag. Another medication they give you to take is a few days before you have your surgery. It's an antibiotic so that you don't get an infection afterwards. You also have to go to the clinic. They give you this chart. You have to go back to the clinic certain numbers of days, like certain days throughout this process, so that they can monitor and see, are your eggs growing? How many are there? If they need to adjust your medications, and they do labs on those days too. So, and they see the eggs with the ultrasound. I had to go back every other day for a week before my surgery. My surgery was on December 10th. So it probably was only like 2 weeks that I had to do these shots. And so the surgery, the day of surgery, you come in, they prep you. Basically all you do is you change clothes. They put an IV in so that they could put the anesthesia in, just knock you out for a little bit, and the actual surgery itself doesn't take long at all. Afterwards, they give you a prescription for pain medicine, because it's fairly painful after the surgery. Like, it's pretty, like, there's like a sharp, I don't know how to explain it. It's like a cramping feeling, like a dull feeling. And it was like that for me for almost a week. It might not have even been, but like for 3 to 5 days. It's not that bad. But you definitely want to have pain medicine on board. Also, when you're doing the shots, some of the side effects that I had was nausea, and I think I actually had thrown up one time. And then, like, as your eggs are growing, it puts pressure. I don't know how to explain. It puts pressure, and it also feels like a cramp. It's just really uncomfortable feeling. But I can't even honestly remember it, and it was not even 6 months ago. So once it's all said and done, like, you won't remember it. But that's basically that whole process. So that's all I wanted to really address with the actual egg retrieval surgery. And now I'm gonna go back to that comment that I made at the beginning of the video as to why I'm still doing chemo even though I'm in remission. So I did 4 rounds of chemo, and then they did a repeat PET scan. PET scan was clean, in complete remission. Spoke to my hematologist. He said, awesome, great. Now we're gonna schedule you to see the stem cell transplant doctor over at MD Anderson, because that's the hospital I chose to use, because my hematologist hospital is not in my insurance network. So I chose MD Anderson because they are. Met that doctor. I was thinking, oh, they're just gonna take my stem cells, harvest them, and when the cancer comes back, I'll just have the transplant. That was not the case. That was not the case. he told me that he doesn't want to wait for the cancer to come back, because the type of cancer I have had responds well to chemotherapy usually the first time, but when it comes back the second time, it comes back more aggressive than it was the first time, and doesn't really respond to chemotherapy very well. So he didn't want to risk it coming back before we were able to do the transplant. So he sent me back home. I had to get 2 more rounds of chemo. I've had 1 round. I have my second one Friday, which will make 6 rounds altogether. And I was supposed to have my transplant, start the transplant process at the end of this month, but that was moved to June because of the COVID-19 that's going on right now. And I'm not going to go into extreme detail about that process. I kind of actually want to wait, make a separate video for that until after I've experienced some of that for myself, and then I can speak on that. But that's why I'm still doing chemotherapy, and it's also makes me thankful that I did decide to have my eggs frozen, because stem cell transplants sterilize you. So the chemo alters your eggs, but the stem cell process for what they need to do will eliminate any that you have left. So it's a lot to take in at 26, you know, especially since I don't have any kids yet. But that's what I have to do. That's what I did, and I'm really grateful for it. And I wouldn't change it or do it any other way. But that's pretty much all that I was going to talk about in this video. So if you have any questions or comments, drop them down below. I don't mind answering anything. Or if you have your own experience, you could talk to me about that. My other 2 videos, so my first video was how I found out I had cancer. My second one talks about the type of cancer I had and like specifics on related to that cancer. My next video I plan on doing is going to be about chemotherapy. So what's it like? What's chemotherapy like? What's it like to live with it, having to deal with it, and how it affects your relationships, your mood, your everyday type thing. But I'm not really going to talk about it like in an informative way. I'm just going to talk about my experience, because I can't really speak for everyone, because it's different for everyone. So I'm going to talk about what it's been like for me in my next video. But thanks for watching. I'll see y'all in the next one.